So now we're going to go into pathology of the salivary glands. Salivary glands are exocrine glands, and their function is to secrete saliva. And we have many glands. We have some major glands, specifically the parotid gland, and then we have the submandibular gland, which right here under your mandible, and then you have the sublingual gland under your tongue. Then you also have many tiny glands. These are the minor glands, tiny glands throughout the oral mucosa, and all of them secrete saliva. Now, what can go wrong with these glands? Well, first of all, these glands have little ducts, so they secrete saliva through these ducts into the mouth. So what can go wrong? First one is sialolithiasis. What do you think that means? Just based on your previous experience, have you seen lithiasis before? Hint, hint, the renal section. You would see that with nephrolithiasis, which was kidney stone. So this is a stone in the salivary gland duct. And similar to kidney stones, these arise from dehydration, because dehydration means super concentration of those solids, and then they will precipitate out into a stone. So it presents very similarly to kidney stones. Specifically, what is the symptom that you think about, which is obviously pain. Okay, so it's pain and swelling when salivary flow is stimulated, and the reason why would this happen? Because when you stimulate salivary flow, then you have, let's say there's a stone here obstructing that duct, right? You increase salivary flow, but it can't leave the duct because it's obstructed. So now you're going to increase pressure in the obstructed duct, and that's why you get pain and swelling. So that's sialolithiasis. Next is sialoadenitis. As you can tell from the name, is itis. So it's inflammation of that salivary gland, and it's usually of bacterial origin. So that would be an inflammation, bacteria plus. And why would that happen? Just think about your past history with ducts, inflammation. Why would you get inflammation of a duct? What is the risk factors? Like usual, it's because your duct gets obstructed. As you can see, you get stasis of that fluid, and you get bacterial overgrowth. The other thing that can happen is it can be either from obstruction or reduced salivary flow, or including dehydration. Again, you get stasis of your saliva. Bacteria can grow there, ferment, and then you can get infection. So that's sialoadenitis. These are all super easy. You just know the name. You already know what's going on. Now we're going to go into the salivary gland tumors. Again, usually arise from the parotid gland, which was the one by the cheek, and it usually presents as a painless mass or swelling. It's just a tumor just sitting there. So your cheek has like a fat mass. You don't know why. Why is your cheek getting fatter? It's because you have a tumor there. You may have some symptoms including facial pain and paralysis. And why would that occur? Which cranial nerve is responsible for that in the face? If you remember from the neural lectures. Remember, that's cranial nerve 7. So you can see it's all this the yellow stuff here. It runs right through that parotid gland. So you can get involvement of the cranial nerve 7, leading to facial pain and paralysis. So let's get into the specific tumors. We have both benign as well as malignant tumors. Starting with the benign tumors, we have a pleomorphic adenoma. What is this? This is a benign tumor. It's the most common salivary gland tumor overall. Most common is pleomorphic adenoma, and it's composed of a mix of stromal and epithelial tissue. Stromal is like stuff like cartilage, and epithelial tissue. And that's where we get the name pleomorphic. Pleomorphic means there's multiple different tissue going on. Now note that this thing can actually transform, can have a malignant transformation and become malignant. But it in itself is a benign tumor. Next is the Whorton tumor. This is another benign tumor. It's cystic, and it's germinal centers. That's all you need to know. Germinal center is basically, it looks like a lymph node. It's like a stroma that looks like a lymph node. Now, I remember this is war and germ. So I think of Germany. So Germany was the center of World War II. You could probably debate me on this, but that's just how I remember this. So that's how I remember that you see germinal centers in the Whorton tumor. Finally, we're talking about the mucoepidermal carcinoma. This is the most common malignant tumor, and it's both mucinous and squamous components. So squamous is what epidermoid basically refers to the squamous cell or origin. So that's what it's all. The name again tells you mucoepidermoid, because mucinous and squamous components, and this is the malignant tumor. Okay. So that's it for our salivary gland tumors, as well as our overall pathology of the salivary glands.